Scoring System, Part 1. Liver diseases. MELD score and Child-Pugh score are used to detect the prognosis in end-stage liver diseases including liver cirrhosis, determines how much need a liver transplant. MELD score. Model for end-stage liver disease. The parameters used are serum creatinine, serum bilirubin, INR international normalized ratio or prothrombin time, serum sodium, normal range from 6 to 40. PELD score or pediatric end-stage liver disease. Used for children under 12 years. Child-Pugh score. The parameters used are serum bilirubin, serum albumin, prothrombin time, ascites, encephalopathy, score calculation. If score is less than 7 child's A, 7 to 9 child's B, greater than 7 child's C. Ranson score. Ranson criteria is used to predict the severity and mortality of acute pancreatitis. Let's compare Ranson criteria for acute pancreatitis not due to gallstones and criteria for acute gallstone pancreatitis. At admission, for acute pancreatitis not due to gallstones, Ranson criteria will be severe if below indications are satisfied. WBC count greater than 16,000 cells per cubic millimeter, blood glucose greater than 200 mg per deciliter, serum AST greater than 250 IU per liter, serum LDH greater than 350 IU per liter and age greater than 55 years. At admission, if the patient have acute gallstone pancreatitis, Ranson criteria will be more if below indications are satisfied. Age greater than 70 years, WBC greater than 18,000 per cubic millimeter, blood glucose greater than 220 mg per deciliter, serum AST greater than 250 IU per liter and serum LDH greater than 400 IU per liter. During the initial 48 hours, acute pancreatitis will be severe if hematocrit fall greater than 10 points, BUN elevation greater than 5 mg per deciliter, serum calcium less than 8 mg per deciliter, arterial PO2 less than 60 mm Hg, base deficit greater than 4 milliequivalent per liter and estimated fluid sequestration greater than 6 liter for patients with acute pancreatitis not due to gallstones. During the initial 48 hours, acute pancreatitis will be severe if hematocrit fall greater than 10 points, BUN elevation greater than 2 mg per deciliter, serum calcium less than 8 mg per deciliter, arterial PO2 less than 60 mm Hg, base deficit greater than 5 milliequivalent per liter, estimated fluid sequestration greater than 4 liter. BISAP score. BISAP score is a valuable tool in predicting severe acute pancreatitis in early hours. Parameters include 1 mark each: BUN greater than 25 mg per deciliter, impaired mental status, systemic inflammatory response syndrome, age greater than 60 years and pleural effusion. Score values. If score is less than 2, then 0 to 0.5% mortality, equals 2, then it indicates 2% mortality, and if greater than or equals 3, the mortality rate is 5 to 20%. APACHE 2 score. APACHE 2, Acute Physiology and Chronic Health Evaluation 2, is a severity of disease classification system ICU scoring system. It has not been validated for use in children under 16 years. Pitt score. Pitt bacteremia score, assessment of severity of acute illness index. Ranges from 0 to 14. Greater than or equals 4, indicator of critical illness and increased risk of death. The Glasgow Coma Scale. The Glasgow Coma Scale (GCS) is a clinical scale used to reliably measure a person's level of consciousness after a brain injury. Below table will help you understand the Glasgow Coma Scale. This is the end of part 1. We'll meet you in part 2. Thank you so much.